Welcome back to the lecture series on removable partial dentures. In today's video, we will be discussing about the mandibular major connectors. Before understanding the types of mandibular major connectors, we'll see what is a major connector first. So what is a major connector? Major connector is a part of an RPD which is joining the components on one side of the arch to the components on the other side of the arch. So this is a major connector which is joining the components on one side of the arch to the components on the other side of the arch. So what a major connector should have? What are the characteristics of a major connector? So major connector, it should be rigid to withstand the stresses, and this major connector should not cause injury to the soft tissues or to the gingiva. And this major connector superior border should be parallel to the gingival margin. And this major connector should be made up of an alloy which is compatible. It should not cause any reaction in the oral tissues. And it should also provide cross-arch stability. Major connectors should also provide cross-arch stability. It should not interfere with the tongue and it should not cause any irritation to the tissues. And this major connector should not impinge on any tissue. Major connector should not allow the entrapment of the food materials underneath it. It should not cause any kind of retention of the food particles. And major connector should be self-cleansing. Let us begin our discussion on the mandibular major connectors. Mandibular major connectors are classified into 6 types. They are lingual bar major connectors. This is a lingual bar major connector. And this is a lingual plate major connector. Lingual plate. And this is a sublingual bar major connector. And this is a lingual bar with a continuous bar. And this is a cingulum bar major connector. And this last is a labial bar major connector. Let us understand the design of a lingual bar. Lingual bar is one of the most frequently utilized mandibular major connectors. Lingual bar is having the superior border and inferior border. So this is the superior border and this is the inferior border of the lingual bar. So superior border is tapered towards the gingival tissue. So when you take the cross section of the lingual bar, it is appearing as a half pear shape. This is a half pear shape in the cross section. This is a half pear shape. So in the half pear shape, this is a superior border and this is the inferior border of the lingual bar. So this superior border is tapered towards the gingival tissue. Here, this is a superior border and this is tapering towards the gingival tissue. And inferior border is making up most of the bulk. Most of bulk is seen in the inferior border here. What are the key measurements for the lingual bar placement? For a lingual bar to fit properly, there should be at least 8 mm of the space between the gingival margin and the floor of the mouth. This is a gingival margin and this is the floor of the mouth. Distance from the gingival margin to the floor of the mouth should be 8 mm. If 8 mm of the space is not present, then lingual bar cannot be accommodated. Instead of lingual bar, sublingual bar or lingual plate can be given. We will be discussing about these two designs in the upcoming slides. So lingual bar is positioned at least 4 mm inferior to the gingival margin. This is a cross-sectional view. This lingual bar is at least 4 mm from the gingival margin. This is a gingival margin and this is the superior border of the lingual bar. The distance between these two should be 4 mm. And vertical height of a finished lingual bar should also be 4 mm. In the cross-section, this height should also be 4 mm. So this height is necessary for the lingual bar in order to maintain the rigidity and also to ensure the adequate strength. How is the measurement for the inferior border of the design is taken? Clinically, this measurement is taken by 2 methods. First one is the periodontal probe method and second one is the impression tray method. Let us see what is the periodontal probe method. Here, a periodontal probe is used to measure the distance from the free gingival margin to the floor of the mouth on the lingual side. Now, while doing this, when you are measuring this, patient is asked to touch his tip of the tongue to the vermilion border of the upper lip. So, patient has to touch the tip of the tongue to the vermilion border of the upper lip. By doing this, floor of the mouth comes to a raised position. By doing this, floor of the mouth will be coming to a raised position. So in this position, you have to record the distance from the lingual gingival margin to the floor of the mouth, and the recorded measurement should be transferred to a master cast. So this periodontal method is clinically acceptable and it is showing less amount of variation. So usually out of the two methods, periodontal probe method is preferred. Let us see what is an impression tray method. In this method, an impression tray is used. Here, impression tray should be at least 3 mm short of the floor of the mouth. So this is the lingual border of the impression tray. So this lingual border should be at least 3 mm short of the elevated floor of the mouth. Now, impression material is placed in the impression tray and the patient is instructed to touch their lips with the tongue so that the floor of the mouth will be in the elevated position. So this is holding the impression accurately. So once the impression is taken, the inferior border of the planned major connector can be located based on the lingual sulcus on the cast. And there is also patient discomfort, and it cannot be used in cases where the tori are present. Lingual bar is indicated in the Kennedy's class 3 situation and also in the class 3 modifications. Advantages of the lingual bar are, it is easy to design and easy to fabricate, and it is having minimal contact with the oral tissue. Minimal contact with oral tissue, and it has no contact with the teeth. Because of this, no decalcification of the teeth is seen. And disadvantages of the lingual bar include, when the lingual bar is given in the undercut areas, it may cause food entrapment. By this, we have completed our discussion on the lingual bar mandibular major connector. In the upcoming videos, we will be discussing about the other mandibular major connectors. If you found this video helpful, hit the bell icon below and subscribe to my channel. And stay tuned to Tooth Fairy Tales RG for more videos on removable partial dentures. Thank you for watching.